Olivia's communication was task-focused and dismissive, which made Mrs. Usher distressed and made her disengage in treatment from Olivia. Instead of acknowledging the patient's fear and stress, Olivia dismissed her by saying, "Checking on your house is the last thing on my mind." This invalidated Mrs. Usher's emotions. Olivia continues to do her assessment on Mrs. Usher, and she becomes more frustrated and uneasy towards Olivia because of her dismissive communication. Dismissive or task-oriented communication significantly reduces patient trust, increases anxiety, and limits willingness to participate in care. When clinicians ignore emotional cues, patients become withdrawn, less communicative, and more distressed, exactly seen when Mrs. Usher eventually stops responding to Olivia. As well as this, it is important that supportive communication in acute settings improves cooperation and reduces emotional escalation. Olivia's tone, frustration, lack of empathy contributed to shutdown behaviour displayed by Mrs. Usher. Olivia could have used strategies to acknowledge Mrs. Usher's distress while doing her assessment. Olivia could use emotional validation to make Mrs. Usher feel understood, reducing her stress. Olivia simply could state, "I hear that you're worried about your house. That must be frightening." This will build trust and calm the response from Mrs. Usher. Olivia can use trauma-informed communication to emphasize the importance of safety, choice, and collaboration. This ensures Mrs. Usher is safe medically first, using a statement of, "Let's finish this quick check to make sure you're safe medically. And then I'll help you find someone who can look into your house." This statement will make Mrs. Usher understand that Olivia is going to help her look into the concern of her house, but also continue her assessments during this busy rush. Alongside this, Olivia can use active listening while completing her assessment and use brief reassurance saying, "I understand how important your home is to you. I'll help you as soon as I can." Giving clear explanation to Mrs. Usher will make her feel more at ease to know every step of the assessment, explaining why the assessment is needed. This will help her feel involved rather than dismissed, and maybe even distract her from her stress. Effective communication is a cornerstone of quality healthcare. Communication helps providers bond with the patient, forming therapeutic relationships that benefit patient-centered outcomes. During a disaster, the first response is stress. This can affect the way a person is acting depending on how they can handle stress. It can affect patients by having difficulty, concentration, hyperfixation on one concern, reduced ability to process new information, heightened emotion reactions, impaired memory or recall. This heavily interconnects with Mrs. Usher's stress response. She's only worried about her house and she wants someone to help her to find out what's going on with her house. Natural disasters are a large-scale catastrophic event, converging evidence that indicates that mental health is a consequence of disaster and are often associated through trauma and distribution of personal and socio-economic factors in people's lives. If I were in Olivia's position, I would use calm, empathetic, trauma-informed approach, even in a high workload environment. I would say something like, "Mrs. Usher, I can see you're very worried about your house, and that's completely understandable. As of right now, I need to complete a neurological check to make sure you're safe. This won't take long, and ask me questions along the way. After that, I'll speak with the team to see how we can get information for you." This approach will validate her distress, explain the clinical task, provide a clear plan for her. Professional compassion and not dismissing her emotions. In addition, using soft tone, maintaining eye contact, and positioning myself at eye level will help reduce her anxiety. It is proven that health professionals using a high level of empathy will ensure therapeutic change. Giving empathetic in professional healthcare situations makes the patient feel safe to express their thoughts and problems. This allows better healthcare assessments on patients due to them feeling safe and heard by healthcare professionals.